Welcome to the Mental Health Colorado Toolkit tutorial. Mental Health Colorado is leading the fight to bring more mental health and substance use services to schools. In 2018, Mental Health Colorado developed our toolkit. It's a set of best practices to improve the availability of mental health and substance use prevention and intervention in K through 12 schools. The toolkit is modeled on the CDC's Whole School, Whole Community, Whole Child framework. In it, schools, health agencies, parents, and communities share a common goal of supporting the health and academic achievement of students. Research shows that the health of students is linked to their academic achievement. 1 in 5 children and adolescents will have a serious mental health concern at some point while they're in school. Evidence supports the idea that children are more likely to access mental health services provided in school, but significant barriers prevent many students from receiving such support. So Mental Health Colorado developed the School Toolkit to help teachers, schools, and district leadership, families, community advocates, and mental health professionals to work together. It supports the well-being of all students. It's not a curriculum or a program, but instead a guide for schools and districts to identify their target areas of growth, explore solutions, and identify funding options. The toolkit outlines 10 best practices for schools. Number 1, incorporate mental health as part of an overall health and wellness strategy. Number 2, use screening, identification, and referral systems. Number 3, teach social and emotional learning. Number 4, provide mental health support with school-based health centers. Number 5, partner with mental health and substance use professionals. Number 6, support teacher wellness. Number 7, reduce stigma through better understanding of mental health. Number 8, implement positive behavior interventions and supports. Number 9, use trauma-informed practice. Number 10, use suicide prevention initiatives. The toolkit offers strategies and ideas for how to implement each of these best practices, depending on their unique needs. The Toolkit Assessment Tool will help schools or districts evaluate which best practices they're doing well in and which they should prioritize moving forward. Making changes can be daunting. That's why we also developed the 6 Steps to Change Guide as part of our toolkit. These are the steps that you can take today. Read through them now. Now is the time for you to be a champion for children's mental health and bring this toolkit to your district. If you're worried about how to pay for all of this, the toolkit even includes ideas for funding. You now have all the tools you need. Let's get started today. Identify a champion in the school system, download the toolkit, and set up a meeting with your school or district. Do you have a district in mind? Let us know. Contact us if you need help connecting with your school district. We'd also like you to let us know which districts you're working with so we can track our progress across the state. Our goal is to reach all 178 school districts across the state. By empowering families, teachers, mental health practitioners, and community members, you can make a difference in the lives of Colorado's children. Thank you for being a champion.